Hi, and welcome to the GP series by Disruptive Doctors. I'm Dr. Selina, your host and co founder of Disruptive Doctors, and today we're diving into the topic that's creating a buzz in the GP clinics: aesthetic practices and regenerative wellness space, stem cells, and exosome. But instead of focusing on the hype, we're cutting through all that noise and going to the science that matters. And joining me today is Dr. Daniel, the founder and chief scientific officer of CytoHealth. And he's here to introduce a framework that every clinic owner, GP, should know when using biologics in their practice, the 5C exosome concept. So let's join in. Hi, Dr. Daniel.
Hi, Dr. Selina. Nice to meet you.
So let's start at the very, very beginning. What exactly are stem cells and exosomes?
Okay, that is a very general question, but of course, me not being only in the industrial, I'm also teaching in university. So I will break down your question into several questions. First of all, what type of stem cell that we are talking about, right? In the market, you see a lot of stem cells ranging from the plant stem cells, animal stem cells, and of course, human stem cells. So me, myself, we work more on human stem cells. And in human stem cell itself, there are various of sources. We taking it from cord blood, where we're talking about blood stem cell, cord blood stem cell for leukemia. You can take from dental pulp, is very famous last time. And if in Korea, we talk about fat derived, that means when people do liposuction, we actually harvest the stem cell from the fats. But in Malaysia, we actually focus more on umbilical cord Watson jelly derived stem cells. So that answered the first part of the question. We are looking into that particular type of stem cells. And then the next thing of it is that what is this kind of stem cell, right? So we know that one unchangeable rules in human anatomy is that we will get old. There will be degenerative diseases. There will be reduction in organ function and things like that. So every time when there is an injury or there will be a degenerative condition in the organs, the stem cells from your bone marrow or from your peripheral blood or from your organ reservoir will come to repair the damage. So put it short, stem cells is actually your fixed deposit that you have in your body to overcome damage, to overcome aging, to overcome degenerative cells and tissue. So that is the main function of a stem cell. Then the last part of the question is that what is exosome? Right? For years, we believed that stem cell is the sole and only mechanism for regeneration. Until recently, especially during the COVID time, we realized that stem cells actually secrete many, many secretions. And one of those secretions are actually exosome, which function as the signaling molecule between cells. Now, I'm being interviewed by Dr. Selina through apps, right? So my voice, my gesture, the word that I choose are all signaling molecule so that the public can understand, okay, the audience can understand what I'm saying. But for cells, they don't have this. So what cells do, they secrete exosomes so that the other cells, the cells next to them, will know what to do. So exosome is that message. If you take it particularly from mesenchymal stem cells, the message will contain many, many important molecules for regeneration, anti-inflammations, and to prevent cell death.
So, how does this exosomes work?
Okay, in a normal condition, let's say in your normal human body, when you have an injury happen, so two things will happen. The first thing is that stem cells, like what I say, from your reservoir, will actually migrate to the damaged location based on a mechanism we call homing effect. Means that when your cells damage or get old, they will secrete a chemical called cytokines. Ask for help. Yeah, it's like a SOS signal by the cells. So the stem cell will capture the SOS signal and start migrating to that area, to replace the damaged cells if the cells are too bad in condition, or to save the cells if the cells are in a situation that's still savable, it still can be helped. So that is one thing. The second thing is that the cells will realize I am just a few stem cells. It can be a few millions, a few billions, but it's just a definitive number. Regeneration need more than that. So how? This stem cell will start secreting exosomes to ask help from the adjacent cells, to ask help from the nearby cells, so that they can join in to the action to help reducing the damage. So these two things will happen. One, the cells will travel to try to help the situation. Two, they will realize that one is too less. They will start to recruit friends to help. So that is through a mechanism we call secretion. And that is where the exosome comes in.
So, clinically, how does stem cell and exosome work and help with the body's healing or in disease processes?
Okay, put it this way. Each individual will have your capacity for regeneration, and this capacity or this potential has been predetermined when we are born. Why? The stem cell amount in our body is actually reducing over time. Okay, so for example, when we are much younger, even a fall, a more severe fall, you see that the wound actually heal faster. The wound will actually heal without forming scar. Why? Because scar only happens when we are much older, because scar is actually dead tissue. And scarring happens mainly because of, for example, if during a fall I have 100 cells being damaged, okay, just a number for calculation. If my body can provide 100 cells to replace those dead cells, then you will heal perfectly. That happens when we are younger in our life. But when we are slightly older, then we start forming scarring. Why? This time, the same fall, the same 100 cells is damaged, but this time my body only have 50 cells to replace. Then the remaining 50 cells, it will be there, it will be damaged, continue damaging it, and then it will be a dead cells in moment of time, and it will form fibrotic cell, which is a scar. So how stem cells or exosome can help in this is that as we grow old, our reservoir reduce. Stem cell treatment, exosome treatment is a way to pump up that reservoir. It's like your body have not enough cell for this action, we give you more. Yeah.
So does that mean that it's only for injury and diseases from this point onwards, or it also fixes whatever that was in the past?
Okay, this is a very interesting question. I always, during my lecture, I will say that our body operate in two main mechanisms. One is the homeostasis, means that if anything fluctuates from the middle part, your body will pull it back, right? So during a fever, if our body is heat up, then we'll start sweating to bring down the temperature. The second principle that our body works or depends on very much is actually the threshold. The threshold mechanism, which not many people discussing this except during college lah, or during a degree that we lecturer give. So give you one example. We always talk about probiotic, right? Probiotic is good for the gut and things like that. Why is it good? It's because, let's say if this, imagine your gut is a cinema. Okay, that cinema can cater for 100 people. If that 100 seats is full with bad bacteria, it's already reached the threshold where you will suffer from diarrhea. So what happened is we put in good probiotic. So let's say this good bacteria sit 80% of the seats. The remaining 20% will be still catered by bad bacteria. But because it doesn't reach the threshold, you don't suffer the diarrhea disease. Same go to other disease in our body. Let's say now talk about kidney, right? We talk about kidney. We do many kidney, creatine, creatinine measurement, other EGFR and things like that. If your readings start to go up, right, the doctor will always say, although that, hey, you need to take care because your kidney function is reducing, you drink more water, reducing. But the moment it touched this threshold, it will become a disease. Then suddenly yesterday is still a kidney function reduction. The moment I step on this threshold, I will become kidney failure stage 1. So damage is there all the time. If we provide the treatment after it become a disease, the objective of the treatment is to make sure that it don't go to the point of no return. All disease has a point of no return. So we don't want it to go, and we try to bring it down. But will it lower than the threshold and become normal? It depends how potential is the treatment or how good is the body responding to the treatment. But let's say now the treatment is given before the threshold of disease. What we want to do is, during the damage build up, we want to bring it down. You bring it down so that the patient will not suffer the disease so fast. So it can delay the progression of the disease formation. So there's two layers of explanation.
So does this mean that everyone should get stem cells or exosomes?
In overseas is annual practice for many people. Just that different type of stem cells, some opt for animal cells, some opt for plant stem cells, some prefer human. But in overseas like Australia, yes, they do opt for a yearly stem cell, but we do need to understand in Australia, a normal people can just walk into a clinic or a pharmacy and order a vitamin C drips because it's under their regulation, right? So in Malaysia, we are still slightly bound by the regulation. So it's not that common, but yes, if in terms of take away the regulation, take away the financial constraint, purely answered from the point of science, yes, we should receive the treatment.
Wow. Okay. So you created this concept called the 5C. What does it stand for, and why? How did you come about it?
Okay. The 5C concept actually originated from our 3C concept, which we have back last year, if not mistaken. So since last year, exosome is a word booming here and there. I mean, even my wife can start to Google or to you can type in exosome in Lazada and Shopee, and you will find a product for oral consumption, product for injection, product for topical application. And recently, there are more and more exosome coming up from human to plant, and now there is a bacterial exosome. Yeah, from overseas, I think. So there's so many. When there's so many exosome, people tend to only talk about what miracle they can do, or it helped me to feel younger, more energetic. It make my skin looks better. It make me look younger, turn my hair from white to black and things like that. But one thing, that we as a bioprocessor who works in the lab, there's one challenges that biologics will always be facing if we don't address it properly, which is the inconsistency in the manufacturing. So why is this so challenging? It's because people are so used to synthetic manufacturing, vitamin C, insulin, paracetamol, all those are using chemical synthesizing. Means that if in that one tablet of paracetamol, they say 500 mg is guaranteed 500 mg, be no more, no less, because it's chemical, which we can control. But today, when we talk about stem cells are living cells. In a whole population of stem cells, there are no one cells are 100% alike with the others. Just like human, right? In the whole universe of human, there are no one human which is 100% alike, even if they are twins. That's why if cells itself is already some inconsistent between them, now we are talking about the signaling molecules secreted by the cells, right? Then this only make the whole situation more confusing and worsen. So if we don't manage that in the first place during the manufacturing, what you will see is that the same challenge most GP doctors, most aesthetic doctors, or even plastic surgery surgeons facing when they use PRP, right? I believe PRP is a very common practice in Malaysia. Some use it for OA management, some use it for hair growth, face, complexion, and things like that. But the challenge with PRP is that we never know how much protein we have. It's always doctor injecting 0.5 ml, 0.5 cc of PRP, and then for this moment it works. 2 years later, it doesn't work. Then suddenly, for a younger patient, it works. For older patient, maybe I need to double the dose, triple the dose, and things like that, right? Why is it? It's because our body for PRP, our body is the manufacturer because it's from our blood, peripheral blood. And no one person, the blood composition is 100% alike. So your lifestyle, your platelet count, all plays a role in providing a good PRP treatment. So same back to exosome, why we created this 5C, extended from a 3C concept, is because we realize more and more people are chasing for exosome without knowing the consequences or the expectation of it. Yeah.
What is 5C?
Okay. So C is actually, the first C is actually the cell. Okay. C for cell. Why? Because we realized at the early of the session, we discussed that we usually use or we are more familiar with the umbilical cord stem cell, right? So again, being a researcher, what we like to do is we like to dig into questions that people don't normally ask. So during one of my master's student, what we did is that suddenly we're thinking, the whole umbilical cord is so long. Do you think that the stem cell from the maternal end and the fetal end is going to be the same? It's just one question. Then I was like, true, I cannot guarantee that. Then being a Chinese, again, we always heard about, placenta, deer placenta, sheep placenta extract, So I say, then if we are comparing, might as well we compare the mother end, the fetal end, and the placenta middle end. Then that's form a master project. And from that project itself, we realized that even for stem cells, if you isolate from the same cord from the same mother, carrying the same children, the cells from the maternal end, middle end, which is from the placenta, to the fetal end, is totally different. It's totally different. And we realized that only the 6 cm from the fetal end give the most viable cells and most active cells. So the first thing is the cells. Why? Again, if your cells are so inconsistent, how can you make sure that you have a consistent and good exosome at the end, right? Imagine today if both of us are having stem cell therapy, I'm getting from a cells from the middle part, which is actually the worst. The placenta part is the worst. So let's say I'm getting from the placenta part and you, Dr. Selina, is getting from the fetal end. After the treatment, our comment will be, for my side, will be, why no effect? I think stem cell is fake. It's just, a hype. But from your side, you said that no, my stem cell treatment went great. I feel more energetic and things like that. And during this time, most of the time, the doctor can only explain to the patient using one word. Or everyone body respond differently, actually. So this is wellness. We cannot actually standardize the thing, blah, 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 and blah. Yes, I am not taking away the fact that every patient respond to RegenMed differently, but we also forget that this is actually started from the manufacturer. And so for us, the first C is the cells. And we notice that the cells from the fetal end, that only the 6 cm from the fetal end give the best and most viable cells. So that is the first C. Okay. The second C is actually the culture. It's not the culture that we have in office or as a race or things like that. No, it's culturing technique that we practice in our lab. So what media you use? Is it a GMP media? And growing cells, you need supplement. I mean, just like human, growing cells means that we are, lack of a better word, we are cheating to the cells to let them think that they are inside our body so they will grow. We are giving them that illusion. So just like human, they need nutrients. So what kind of nutrient are you giving them? We run our experiment through 6 different media and supplement, and we realize that some labs are actually using something called fetal bovine serum. For lack of explanation, it's actually cow's blood. Means that we extract the cow's blood and to culture the cells. And we realize that using cow's blood, the cells is distorted. The cells look weird. They grow very slow. It's less viable. And then for us, we use human petalyzate. So which is the same thing that doctor give in a hospital if patient is in dengue, right? Human petalyzate. So when using human petalyzate, the cells grow extremely well. And for me, it's no surprise because that is what is supposed to be given, not a cow's blood. It's supposed to be human pellet protein or something like PRP. So again, going back to the same scenario, if I receive cells that is cultured using cow's blood, and Dr. Selina received treatment using cells that are giving nutrients from human petalyzate, of course, the complaint is still going to be my treatment have no effect and Dr. Selina treatment is great.
Other than it just not having an effect, what happens if someone gets those distorted cells? What's the side effect of it?
Okay, the least one that we want is that the cells is actually not surviving well. The moment you put it into a syringe, it will start to clump. And that clumping, when you put it to the vein, especially through something like IV, it will cause necrosis. It will cause necrosis. So you have burning pain, blood vessels, then you need to flush it with saline. It's a very messy situation. And of course, put aside that where is your cow blood protein coming, right? Maybe more contamination. Do you actually screen it for mad cow disease, right? And then is it easier to contam the culture? If yes, then you're looking at a potential event of sepsis.
Well, sounds like it's a lot of risk factors to injecting stem cells.
Yes and no. Yes is because it's a complex process. It's a very complex process compared to pharma. No is because there are many good manufacturers that follows proper CGMP guideline. For example, you can't see through the video, but actually I have many, many white hairs at the age of 36. Why? The moment I need to go into a GMP, the place for me to culture the cells is as a class B. Okay, just to give an example, an operating theater is a class C. An operating theater where we open up, when patient being opened up for surgery is a class C background. And in our lab, we need it to be class B. So it's already one stage higher than an OT. And the second thing is that we cannot just openly culture cells. We need to put in something called biosafety cabinet. And that biosafety cabinet is class A. So again, it's 2 grade higher than an OT to culture the cells. So if things are managed properly, shouldn't have contamination, and the cells should be healthy and giving regenerative properties. Yeah. So maybe some people will say that, okay, the lab is great, but how about we bringing the contamination in, right? So when we walk into a GMP, the first thing is we take off everything off our clothing. We need to put on a scrub suit. Then after that, we need to put in 1 layer of PPE. Then we need to put in a second layer of PPE. Only we can go in to operate. So that prevents contamination from outwards, and the lab design itself and the SOP itself prevent that the facility have any contamination. So if you go to a right bioprocessing facility, it's not going to be dangerous.
What are the other three C's? You said cell, culture. So what's 3, 4, and 5?
So cells and the culture method is how we standardize a good quality cells. The upcoming 3 C's is actually how we standardize a good quality exosome. So the first one is actually characterization of the exosome. Okay, exosome is actually at nanoscale. Let me just see. Okay, to put it simple, you just plug a strand of your hair, then the diameter of the hair you divide by approximately 1000 is going to be nano. So it's very, very fine and small. So in order to check, do we have things that is so small, right? I can always just bring up a bottle of water and tell you, yeah, this is exosome, because you can't see, right? You can't see. So the first thing we need to do is that we are able to see those exosomes through electron microscope. A lot of people, they don't do that because there are not many electron microscope in Malaysia. Yeah, in Malaysia. So we do that. We do that with Monash University. So that is the first characterization. The second characterization is what we call a biomarker and the size of it. So you need to run that. Exosome is just a phospholipid bilayer nano size delivery system, for lacking any better word, right? So it's very small. It's a phospholipid round shaped delivery system. There are many of round shaped phospholipid delivery system in our body. It can be a apoptotic body. It can be a macrovesicle. It can be an exosome. It can be a microvesicles and things like that. So how do we know that? Even through microscope, we see, oh, this is round phospholipid bilayer. But how do we know this is the exosome? We need to check the biomarker. So we need to have that. Then, of course, the first C is the characterization, okay, for exosome. We need to be able to see it and check the biomarker, knowing that these are exosome. The second C is actually the content. Like what we mentioned earlier, exosome is merely a delivery system. What we want is not the skin of it or the phospholipid bilayer of it. We don't want that. What we want to know is what is carrying within it that give us the regenerative property. So we are very gladful that we are able to work with UKM. We are the first group in Malaysia that able to sequence out the protein profile of the exosome. So now we can, let's say we use exosome for face and we see that the face getting tightened, the complexion is better, the wrinkle is reducing. We cannot just tell the patient, you see, it's improving. Then when the patient asks, yes, I feel great. Why is this happening? Doctor cannot be, let me call my supplier and get back to you in 2 days, right? Can't. So what we do is that we sequence out the whole protein profile. So now doctor can confidently tell patient, so you see, why you see you reduce in this, right? Because these proteins are in it. The C3 is there, the C5 is there, a growth factor is there, and all these actually can promote your wrinkles to reduce, can increase your collagen synthesis. Then that becomes a proper explanation of the manifesting result from the treatment, not just anti-aging, not just, yeah, you see this is result, not that simple understanding, but a deeper explanation to the patient. So the second C for exosome is actually content, and of course the last C is actually the count. For many years, biologics, we are not able to do counting. Like what, going back to the initial example that we have, the PRP is always ml, cc's, 1 cc's, 2 cc's, 0 cc's. But how much protein is in there? We don't know. We can only tell the patient, come back for more treatment if you don't see the effect, or I need to double up the dose from 4 vials of tube, I need to get 8 vials of tube for the PRP, right? So that is the common thing we do. So when we come to the next generation of biologics treatment, the exosome, what we want to do is we are able to count them. We are able to count 1 exosome, 2 exosome, 3 exosome. And of course, why we can do this is again back to the first C for exosome, which is the characterization. We are able to see. If you want to count something, you need to be able to see it first. So we are able to see them, so we can able to count them. So with that, I think now doctors have more understanding, knowing that for a certain disease, for example, for wellness, maybe 500 billion give a good result. For certain disease like OA, I just need 250 billions of particles. And even let's drill deeper, same knee pain, OA stage 1, maybe 250 billion is good. Maybe stage 2, after a few times, they realize that, hey, no, I need 400 billion. Stage 3 OA, now I need almost 700 billion. Able to count, give doctors the option for a better treatment plan. So that is a total 5C. The cells, where we get it from, culture, how we culture the cells, how we characterize the exosome, and how we count, how the content of the exosome, and the last one is the count of the exosome. So total of 5C.
So, how would a doctor know when they say they purchase the stem cell or exosomes from suppliers? Like, how would they know?
Okay, if you look into current how the market is running, they always based on something called COA, Certificate of Analysis. For me, COA is a good way. It's a good way because it's a document where they list out all the uh, QC, all the readings from the testing and things like that. But again, I need to remind all the audience here is that the COA are issued by all the companies outside. It's not through a third party. It's a self-claim and self-issue document. So, but asking COA is the first step. If you want to go deeper than that, you can always ask the company to provide you raw data. Because why? The company need to have run the raw data and then they translate the data into the piece of certificate, right? So to prevent uh, let's say there are some irresponsible manufacturer who reuse the same piece of paper all the time, you should also start to ask for raw data. Means that, okay, great, I see your COA, but I want to see the raw data of this testing. Can you show me? And for any GMP facility, they should be able to, yes, this is the raw data and the batch number is the same, the testing date is the same, and then you translate back to the COA and this is your final COA.
Well, sounds like there's a lot of process here. If you want to provide proper care to your patient and making sure that you know exactly what you're giving to your patient.
Yes, recently I was organizing committee for the Deputy DG Office of Ministry of Health for the stem cells and regenerative medicine engagement meeting. During that meeting, there's one speaker from Sweden, and I like his quote. Okay, I like his quote. His quote saying that stem cell treatment might be the penicillin of our generation. So why I like this quote so much is because going years back, when there is no antibiotic, no one will think that mold is such a benefit organism. If there is any wound, right, what we'll do is take a rat, we smash it in, and then just take the extra effort on the wound, hoping that the patient will survive from those kind of dark magic, right? Until someone developed penicillin. But when penicillin was first developed, no one trusts it, no one believed it. Um, Leftover dishes, that thing can help me to combat my infection? No way. But now with today knowledge, we know that penicillin actually changed our medication ways of dealing with infection disease. Same stem cell today, why many doctors will feel that it's a bit risky, it's dangerous, like what Dr. Selina mentioned, is many process is because we are not taught in the medical school on stem cell during our era, right? So now when doctor want to learn about stem cells, is only through um, like for me, I teach in degree, master and PhD. Of course, it's a more proper kind of course. If not, then you just like courses, CPD course, seminar, workshop, and things like that. The information that they get is very in pieces and not putting it into one whole frame. So the confidence level is lower. So of course, we will not be worried about it. But let's say if the Ministry of Health or the Ministry of Higher Education start to incorporate stem cell and regenerative medicine, which they are doing in UPM, in UKM, in they're already starting to have courses on regenerative medicine. Those new generation doctors who graduate from those courses, they will come up confidently tell you, I know how to QC a cells, I know how to count the cells, I know what cells is best for my patient. So back to the comment earlier that, a long process is because the user, especially the doctor, don't fully understand it because it's not taught during their med school. They learn it through their experience and workshop. So of course, we hope that the education system can slowly open up so that doctors from the next generation, they will understand biologics more.
Well, I also really like that quote because basically we are in an inflection point. Because if you're talking about penicillin, that is when the lifespan of humans, of people expanded, right? Like,
Yeah.
because back then there were a lot of infections, people were dying very young. The moment they found penicillin, everyone survived infection,
Yeah.
and our lifespan increased till today to like 70 plus. So
Mm.
if you're saying this is possibly the penicillin of our era, then who knows? Humans could be living to what, 150?
Yes, and that is example that we see in some country in Japan. Of course, we always say that it's because of the lifestyles. I'm not taking credit out of it, but you must also understand that in Japan, RegenMed is very established. You can even claim PRP, from their social security if you use it for disease like OA. OA itself might seems very small. Imagine if a 70, 80 years old uncle and auntie, they are able to walk more, they exercise more. When they are able to walk more, they can interact with their family members more, hence less mental stress. And of course, when they can work more, means that they can work more. They can contribute back to the society more, and that build self value and things like that. And hence, I think that comprehensive support system make them more active, and from there, of course, a longer lifespan. Yeah, then and that happens because of one OA, right? Imagine if more disease open up, you will see a greater extension. So I do agree that human lifespan can be managed to extend slightly longer.
Yeah, because OA, like you said, you think it's a small thing, but the pain can affect their mental health. Their inability to mobilize puts pressure on so many people, not just themselves, but their caretakers.
Mhm.
So people might, I mean, they lose hope in life and living and all that. And with all of that, they may not want to live longer. But imagine, because I'm imagining myself, if I'm confined to a wheelchair, I rather not continue living, right?
Yes.
But if I'm 90 and I'm still hiking, I'm still doing so many things, I would
Mhm.
still want to live.
Yes, yes. There's quite a surprising move from the Ministry of Health from Singapore, our neighbor. In year 2023, they actually give out a new directive where they actually conditionally approve mesenchymal stem cell use for chondrocyte regeneration in certain institute. So even Singapore noticed that, and we always say that Singapore is one of the most cautious medical nation in the world, and they are opening up, and approve it for, of course, for now OA, for other disease, not sure. So yes, I do see the potential of regen med booming in Southeast Asia or even in a global scale.
So tell us how is CytoHealth different from every other stem cell providers out there?
Okay, let's start with the founder. So this company starts solely on me and my partner, Dr. Wong. We start this regenerative company because of we simply feel sad when during our era, the only stem cell technology which is approved for clinical trials only from China and one is from India. They are brought into Malaysia, run the clinical trials in Malaysia, and by the way, it's stuck now. But after that, this product will be registered back in their own country and sell at an extremely high price to Malaysia. So we were thinking, we are scientists. Dr. Wong is also a PhD in biotech. Why we can't have good product and good technology originate from Malaysia, tested on Malaysia population, and provide to the Malaysia population? Because that will be the most accurate treatment. We are talking about epigenetic, we are talking about how different race or how different part of your genetic will affect the treatment efficacy, right? So why not to have a company who focus on local developed technology? And that is how CytoHealth started. The moment we started, we worked with university, and to now we already have two approved clinical trials in Malaysia, and this technology are 100% developed in Malaysia by Malaysia researcher. One is with UKM. That is a collagen patch where we actually extract collagen to make into a medical device and to heal full thickness wound within 14 days. Yeah, the
Wow.
other one, yeah, and um, for us is that currently that the same competitive product that is competing with our intervention is something called Integra. That Integra is selling at 7 to 8,000 per piece at the hospital, and that is the price to the hospital. And the hospital will have certain markups to the patient. So when that piece of thin, transparent silicone reach the patient, it will become maybe 10K. What we are trying to do is reduce that by tenfold, meaning that the same collagen to treat the same disease, but now because of locally made, locally researched, locally distribute, we are looking at 1,005. Yeah, so that is how great if you can have your own country developed product. So that is the reason why we started CytoHealth. And I think the belief is very important because from there, because as scientists, of course, people will think that, you can't run a company properly. We are normally nerds with thick glasses, which somehow in this case is right. But yeah, we try our best to work with people to learn to how to run this company on one basis. Every single thing from our company needs to be based on our slogan, which is evidence-based solution, because that is how I was trained in my PhD and how my partner was trained in her PhD. So everything, when you talk about that this media is good for stem cells, show me proof. After that proof, I will take your proof and we run 3 times to see is my data same with your data before I integrate this into my system. So
Wow, that's very powerful. If there's one message for doctors to take away today, what would it be?
evidence-based. Choose your supplier on evidence-based, means that not only the COA, raw data, when you treat the patients, evidence-based, means that don't just guess that is stem cell work or not. In fact, for us, we form a system called Cyto Academy, because me myself, I'm teaching in Taylor's. So I have access to many journals for free, which normally we need to pay and download. So we are disrupting the system in a way also. So we download all the paper, and for all doctors who want to learn, right, they can just contact with us. We can actually invite them and then send them clinical trials. For example, OA. We cannot be guessing, how many stem cells that a patient needs. So there are a list of clinical trials that we list out, how much stem cell they inject, what is the treatment plan, what is the outcome, what to monitor. From there, develop an evidence-based treatment plan for your patient. So if I need to choose a simple sentence, I will go with evidence-based.
Okay, thank you, Dr. Daniel, for sharing your expertise. And for you guys out there, if you're looking for stem cells, check out CytoHealth, support local. And Dr. Daniel will also be at our Disruptive Doctors annual conference this 20th and 21st of September in Sime Darby Convention Center, where he's going to share more about what stem cells is, how can doctors use them in their practice. Until then, stay curious. I'm Dr. Selina. Thank you.
Thank you. See you all.
Join Disruptive Doctors. Oh, oh, Disruptive Doctors.